Hello and welcome to COVID Conversations here on WNCU 90.7 FM. I'm your host, Kimberley Pierce Cartwright, and we're streaming on YouTube, Facebook, and Instagram. I'm your host. I'm the Public Affairs Director here at WNCU, and we're using the Zoom platform to talk about COVID-19 and how it is affecting our world. The Centers for Disease Control and Prevention and the American Medical Association are working in partnership with the Ad Council to raise awareness of their national Do I Have Pre-Diabetes public service campaign. And with me today to talk about it is Dr. Christopher Holliday, that's with 2 L's. He's the director of the Division of Diabetes Translation at the Centers for Disease Control. Dr. Holly, hi, how are you?
I'm fine, Kimberly. How are you today?
I'm doing good. First, let's talk about the partnership between these 3 agencies.
Yes, as you mentioned, the American Medical Association, along with the CDC and the Ad Council, have launched a national campaign to really shine a light on a serious health condition, as you mentioned, prediabetes, and the urgency with which people need to know their risk and then do something about it to prevent progression to type 2 diabetes. And prediabetes is a serious health condition. It puts people at risk for heart attack, stroke, and of course, type 2 diabetes.
So what is diabetes? I mean, in the African-American community, a lot of times you hear, well, I've got sugar and this kind of sugar is not sweet. It's diabetes. So what is diabetes?
Yeah, great question. So we often hear people say a touch of sugar or diabetes in different, communities. And it's important to know what that means. And people with type 2 diabetes are really unable to regulate their blood sugar or their blood glucose. And they have to manage their blood sugar with either medication or lifestyle management. And it's really important to understand that people with pre-diabetes, it's not high enough to be considered diabetes, but your blood sugar is higher than normal. But it really still puts you at a high risk for those other serious conditions. So that's why we think we want to drive home that prediabetes is really where you have to pay attention. It's really a wake-up call.
Yeah, so people are actually walking around in pre-diabetes, and they don't actually know about it. What would be some of the things that might be a red flag to say you need to go to a doctor to see about this?
Yeah, unfortunately, prediabetes doesn't have any symptoms, but there are risk factors to let you know that you may have it. And that includes being overweight, not being physically active, having a parent or brother or mother or sister, a close family relative that already has type 2 diabetes, being over 40, having a history of gestational diabetes if you've had a baby, and obviously being Black, Hispanic, or other ethnic minorities like American Indians, Alaska Natives, for example, are at higher risk. The good news, though, is, as I mentioned, prediabetes can be reversed. Right now, 1 in 3 American adults, that's 96 million people, have prediabetes. And as you mentioned, 81% of them don't know they even have it because there are no symptoms. So you have to understand what the risk factors are and be able to do something about it.
So can we talk about how common is diabetes? How common is people within maybe ethnic groups, if you could help with that?
Yeah, over 37 million people in the US have diabetes. And ethnic minorities often have a disproportionate burden of that because of many factors. The AMA, the CDC, and the Ad Council all recognize the effects of inequities and racism and social inequality in our culture that puts people at higher risk by impeding their access to healthcare, access to fresh fruits and vegetables, to walkable communities, and that often causes more incidents, meaning new cases of prediabetes and diabetes.
And then all on top of that, here comes COVID-19.
Yes.
So how can having diabetes increase risk of severe illness from COVID-19 for people?
Yeah, one thing that we've realized is that chronic and infectious diseases are often thought of in separate lanes in both public health and in healthcare. But the COVID-19 pandemic has further underscored how intimately related these two lanes are and how critically important it is to prevent chronic diseases like type 2 diabetes whenever possible. And of course, for people who have one or more chronic conditions, this pandemic has shown how maintaining optimal care and management of those chronic conditions can really help reduce the risk of more severe outcomes due to infections like COVID-19 or influenza, which can lead to hospitalization, mechanical ventilation, intensive care, and even death.
I want to talk about go back just a little bit to talk about diabetes without COVID. So what are some of the symptoms? What are some of the risk factors? What happens to you when you have diabetes, or the risks of things that could possibly happen because you are diabetic?
Yeah, symptoms of diabetes can be increased thirst, fatigue, tiredness, frequent urination. Those kinds of symptoms are very common among those with diabetes. And it is important that well-managed and well-controlled diabetes, whether it's through a medication and or lifestyle changes, modest lifestyle changes, losing a bit of weight, moving more, eating better, are all helpful in managing your diabetes. But that having diabetes does put you at increased risk. And COVID-19, meaning for severe illness due to COVID-19. And so it's really important that people try to manage their blood pressure and blood pressure as well, but blood sugar in consultation with their physician.
So I've heard of people having to have amputations because of diabetes, people losing their sight because of diabetes. Is that true? Are those some of the kinds of things that if you don't manage your diabetes well, you could be victim of?
That is absolutely true. In fact, diabetes is not well managed can lead to anything from diabetic retinopathy to chronic kidney disease, amputations, to any number of complications, including heart attack and stroke. And so when people have diabetes and they're not seeing their doctor, they're not accessing care, they're not taking their medications as appropriate, they're not eating well or reducing their stress, these complications over time could be the result. And so it's really important when you've been given a diagnosis of diabetes to really take it seriously.
And then with COVID, so that just amplifies what's happening on top of all the other things that could be happening. Then you could have COVID and really be in a serious situation.
That's right. The urgency of COVID-19 has really driven home for all of us how important it is to really maintain appropriate prevention strategies so that people don't get prediabetes and diabetes, but also if they have diabetes to manage it well. COVID-19 may have indirectly really increased people's risk for diabetes because, remember we were in a quarantine period and that led to us having more sedentary lifestyles. Some of us had restricted food choices causing excess weight, and then people might have even delayed or disrupted their medical care. And all of these factors as a result of COVID really will put people at a worse position with diabetes or prediabetes. And these are factors that really lead to worse complications if someone gets COVID. Actually, our research shows that chronic conditions like type 2 diabetes really, for people that contract COVID-19, they're 3 times more likely to become severely ill. As I mentioned earlier, that's not just hospitalization and intensive care, but in the US, 15% of COVID deaths were among people with diabetes. So there's an urgency there that people know their status and do something about it.
So Dr. Holliday, when I think about diabetes, I think about it as an elderly person's disease. Is that true?
That is no longer the case. That obviously being older puts you at risk particularly it used to be over a certain age, but now it's over 40. And as we in our culture have gained a little bit more weight, have more access to high fat, low nutritious foods, that risk factor among US adults is now something that young people have to think about and have to maintain. With the recent obesity epidemic among young people, that's putting more of them at risk for prediabetes and type 2 diabetes. So it's really important across the lifespan to maintain a healthy weight, to eat well, and really to make sure that you reduce stress and prevent these chronic illnesses in the first place.
Okay. Can you break this down for me? Okay, you got pre-diabetes, then you have type 1 diabetes, and then you have type 2. So could you give me the differences between all of these medical situations?
Yes, people with type 2 diabetes are unable to regulate their blood glucose or blood sugar, as I mentioned earlier, and then some lifestyle management and or medication could help them to regulate their sugar. Now, those with type 1 diabetes do not produce insulin, so they need to be given insulin or take insulin, which is a life-saving, generally an injection daily to manage their type 1 diabetes. Prediabetes, which is actually for us the wake-up call to prevent type 2 diabetes. It's just when your blood sugar is elevated. It's not quite high enough to be type 2 diabetes, but it does, again, put you at high risk for serious health conditions.
So could you tell me that? So if I don't know it, then how do I go about finding out more about my health? Okay, and then maybe diabetes would come up in the conversation. But if I don't know, then how do I become more knowledgeable about this disease?
Yeah, I would encourage everyone to keep their regular annual doctor's appointments. And as part of our routine care, often your hemoglobin A1C or your blood sugar is checked as part of those routine examinations by your primary provider. And that tells them whether you are at risk, have prediabetes, or if you have diabetes. So it's really important to keep those regular appointments with your primary care provider. Also, those risk factors that I mentioned earlier, being overweight, being over 40, having a close family member with diabetes, and being of a ethnic minority status are all indicators that you could be even more at risk for prediabetes. And so we encourage your listening audience to go to doihaveprediabetes.org and take that simple 1-minute risk test and know your status.
So reversal of pre-diabetes, does it have more to do with diet or exercise or combination of both, or you don't need medication to pre-diabetes? So how is it that we can get ourselves from pre-diabetes to a better place in our health?
Really great question. And so prediabetes is why we say that's the wake-up call. When your blood sugar is starting to elevate, but it's not quite diabetes, you can change the outcome. You do not have to progress to type 2 diabetes, and you do not have to really go through all of the complications that we mentioned earlier for diabetes that's not well managed. And that's why it's so important for us to talk about prediabetes as a warning signal. You can change the outcome. And so once you take that 1-minute risk test and know your status and talk to your physician, you can do modest lifestyle changes like lose weight. And this is a modest amount of weight. We're not talking hundreds of pounds or 20 or 30 pounds, just modest weight, 5 to 7% of your body weight. We at the CDC lead the National Diabetes Prevention Program, and these are lifestyle change programs. There are nearly 2,000 across the country that people can find a program near them once they go to doihaveprediabetes.org. And this particular program gives you an individualized lifestyle change coach or lifestyle coach that tells you how, helps you to walk through what you need to do, the modest changes you need to make day to day. So you actually have a support system. So people don't have to do this alone. And so I'd encourage them to go to doihaveprediabetes.org, find a program near them. They're both online and in person, and get that personalized coach to help you walk through how you can prevent moving to type 2 diabetes.
Dr. Christopher Holliday, it's been a great conversation. And Dr. Holliday is the director of the Division of Diabetes Translation at the CDC. Thank you so much, Dr. Holliday, for your time.
Thank you, Kimberly. It was a pleasure.
You're welcome. And thank you, audience, for watching via YouTube, on Facebook and Instagram, as well as listening on WNCU. We want you to like us. We want you to follow us and become a part of our community. And you will be able to, on these platforms, become someone who can go through our archives and see all of our old shows. I'm Kimberly Pierce Cartwright. I'm your host for COVID Conversations, and I thank you so much for tuning in.